Welcome to the Road to Recovery, Hope and Healing in Mental Health. Joining us today is Dr. Paul Erickson, Medical Director for Psychiatry and Addiction Medicine at Cottage Health, and Dr. Margaret Ballman, Medical Director for Psychiatry and Addiction Medicine at Cottage Health's San Luis Obispo Outpatient Program. Today we're talking about post-traumatic stress disorder. To open the discussion, first of all, what causes PTSD?
Well, many things can cause PTSD. Back when I was in training, all the research was focused on vets who had been in war. But now we know that there are many other things that can cause PTSD, including childhood abuse and sexual assault.
The core idea in experiencing a traumatic event that leads to PTSD is that the event is life-threatening or causes you to fear that you're going to suffer great bodily injury or death. So it can range, as Dr. Bowman was saying, from combat to natural disasters to assaults, things like that.
Sure, so what are the symptoms of PTSD?
Well, some of the symptoms that people may report are things like nightmares or intrusive, vivid thoughts of the trauma that sometimes hit them in the middle of nowhere, and it's almost as though they're seeing it right there in front of their own eyes. Along with that, you can have avoidant behavior, where I've talked with people who are unable to go into certain situations or in certain places because it brings to mind their past trauma.
So the two broad categories are that people re-experience the trauma, and re-experiencing means that you don't remember the trauma as a story, as most memories are stored. You re-experience it physically. A cue might cause you to go into a panic state. You may have nightmares that come spontaneously or flashbacks. And then the other side of the coin is that people become withdrawn and they become flat in their emotion and withdrawn from others as almost a kind of protection against re-experiencing that trauma.
They're quite hypervigilant, meaning that they could be sitting here in this room and the slightest noise, say the heater or an air conditioner coming on, and they will stop talking. They may jump, and they'll look around just to make sure that they're okay.
Sure. Does everyone who experiences trauma develop PTSD?
This is a common misconception. Many people experience traumas, and many people experience traumas that are potentially life-threatening even. And not everybody develops post-traumatic stress disorder. In the short term, most people have symptoms that are something like PTSD. It's called acute stress disorder. But over time, most people recover and don't continue to have symptoms, but a significant minority do.
Currently, at least according to the latest statistics, the lifetime prevalence of PTSD is around 8%. For the last 12 months, the prevalence is around 2.5% to 3%.
So can PTSD improve? Can it get better?
Yes, it can. It generally requires some very specific treatments, but it can get better. And again, seeing a licensed professional, working with someone who is very familiar with some of the psychotherapies and some of the treatments involved is important.
So as with most mental health disorders, the combination of medication and psychotherapy is usually most effective. And the medications that are most commonly used are serotonin antidepressant medications, but others. And the psychotherapies that are most commonly used are cognitive behavioral therapy that's specific for PTSD and exposure therapy.
And I guess to wrap up, how can I help someone with PTSD?
Well, part of this is talking with them and just being upfront about it. I think there's a lot of shame, there's a lot of stigma about all mental illnesses, and particularly this mental illness. There's a lot of shame because if you're talking with someone who perhaps is a sexual assault victim, it is very difficult for them to feel like they can be open and trust someone. So sometimes just bringing up some of the symptoms and encouraging them to get treatment is very helpful.
People often feel isolated. Being able to talk about what they've been through brings some relief. Group therapy for people who've been through similar traumas is very helpful for people. So encouraging people to get help and to be able to talk about what they've gone through is important.
To learn more or share this interview with a loved one, visit cottagehealth.org/road to recovery. Tune in next week when we discuss schizophrenia.